Hello friends, and welcome to Sterile Field Guide, a podcast dedicated to medical student general surgical education. I'm Alex, and I'll be your guide. Hello friends, happy Monday. In this episode, we are going to talk about how to study for your shelf exam, specifically your surgery shelf exam. This will be a short and sweet episode because the rest of this podcast is sort of dedicated to giving you some knowledge that will be helpful to you on your surgery shelf, but just some logistics on how to take your shelf, what shelves are like. I would say for me specifically, I would say that the shelf exams are not something that you necessarily really need to stress about. This might differ based on where you go to school. For instance, here we need a certain threshold to pass, and that's sort of as good as it gets. Passing is passing and failing is failing. If you are at a school where your score really matters, that makes a difference. I will also say that your shelf exams are fairly representative of how you would do like in the moment on step 2. And so if you are using your shelf exam sort of as a measurement for how ready you are for step 2, your score matters more. So grain of salt, I guess. If you just need to pass it, they're not as stressful, but if you really need to bust out a score, they can be more stressful. That's probably something that you already intuited. However, I would say if you just need to pass them and get a certain threshold, they are something that you should study for, but not something that you need to necessarily have a ton of anxiety about. They don't last very long. We usually took ours from 8 o'clock until 11:30-ish, and sometimes you would get done with them before the time was over. Some people took the whole time, but it's really not that long of an exam comparatively to some of the exams that we took at my institution, which sometimes we had exam weeks that were 18 hours long in total or more, which was wild. So for the shelf exams, I would say my number one study resource for every single shelf exam that I took was UWorld. There are people in this world who do not use UWorld, and if you are one of these people, probably all of my tips will not apply to you. I would recommend doing UWorld. I haven't done the other question banks, so if you are relying on another question bank, probably would recommend doing those as well, but I will speak to what I know for UWorld. I would say it is possible for you to do all of the UWorld questions, even if you are staying the whole time that you are even allowed to be in the hospital as a medical student. It is okay also for you to work on UWorld in the hospital as long as all of the work is already done. So you've seen your patients, you've pulled the JPs, you've done the dressing changes, you've written your notes, you've done all the things, and you're either waiting for a case, waiting for something to happen, you're in between cases, it's lunchtime. From my perspective and residents that I've spoken to, it is okay for you to be working on UWorld in the hospital, even to the point where people can see you doing work and studying, as long as you have done all of the work that you need to do and taken the steps to go above and beyond for your service before you start serving yourself. Take advantage of every moment that you can to get your studying done so that when you go home, you have time to eat and sleep, which are two things that can very easily go out the window when you start clerkships, especially busy ones. And then maybe also you'll have time to exercise or do something that you enjoy doing if you get your studying done while you're in the hospital. It's also pretty nice to see some questions on UWorld and then see it come full circle during the day, because the things that you're learning for your surgery shelf are basic normal things that you will see in the hospital, and to have that learning experience on paper or on your computer and then see it in real life is really awesome for solidifying knowledge. So I think it is okay to study in the hospital, but again, don't serve yourself before you have finished serving others and going above and beyond for others, because it kind of looks bad. But it is okay to study in the hospital. So I did all of the surgery questions. My general approach to figuring out how much UWorld I need to do is taking all of the UWorld questions and dividing them by the days that I have to study, which is similar to what I did for getting my points for step 2, if you listen to that episode. So divide however you need to do. If you are a person who likes to chunk it and get a little bit done every day, that's an option. If you think, you know what, I am just going to do a couple blocks of 40 on the Saturdays, and then during the week, I'm not going to worry about it, that's also totally a fine option, but I would just say don't leave it all until the end, because again, it is good to see all of this stuff happen in real life, and you don't want to be behind and have hundreds and hundreds of questions to do. In addition to the surgery questions, I would also recommend that you do some medicine questions. So if you've done your medicine clerkship before surgery, maybe you won't need to do this, but if you've never done your medicine clerkship and you're doing your surgery clerkship and studying for your shelf, I think it's a great idea to do some medicine questions. The surgery shelf felt very medicine heavy to me and to everyone that I spoke to, so it's not a bad idea at least to get some like GI questions in from medicine, if not doing sort of a smattering of all of the things. So if you want to, for instance, do all of the surgery questions and a couple hundred medicine questions, you can incorporate that into your study strategy. I did not do that, but I sort of wish that I did. So that's something that you can do to learn from me and not do what I did. I would also recommend, I did not use Anki during surgery, but if you can use Anki, or if you are a person who likes Anki, it's not a bad idea to like have the basic things that you keep forgetting sort of on repeat with Anki. Again, you don't have like a ton of free time on surgery or many clerkships, but specifically surgery, I feel like it is hard to have free time. But if you have time to do Anki, I do think it would be a really helpful adjunct. The Emma Holiday videos, if you've not heard of them, they're on YouTube. They are older, like they're a little bit probably outdated, but a lot of the stuff still reigns true. Medicine hasn't changed a whole lot from when she posted those, and she's got good videos for almost every clerkship, so I would recommend watching those. Other books that you can use will be like case files or pestañas. I use DiVirgilia's, but I don't know that you necessarily need to buy DiVirgilia's. It's a little bit more on the expensive side unless you're sure that you're doing surgery. I am sure that I am doing surgery and I still have not purchased it. So if that tells you anything, maybe try to borrow a copy, check it out from the library, or you can just use other resources. I don't think it will hurt you to not buy a whole bunch of other things. There are practice exams available through the NBME. I'm sure that you are able to find them or something like them. And I think my biggest pearl, this is going to be a super short episode, but biggest pearl is like step 2 and shelf knowledge is sort of about, it's more about clinical knowledge than basic science. So you may know everything about the pathophysiology of the clinical problem, which is awesome, and some questions will ask you that, but the shelf exams and step 2 are more so asking you, okay, what do we do with that information? What is the next step? What is the evidence-based practice for this? And so it's a lot of like, okay, yes, we know that we need to do colonoscopies, but this is the finding on this colonoscopy. When is the next time this person needs one based on this result? What do we do with this lab value? What is the next imaging thing we need to order for this type of disease? So pay attention to that when you are studying, because it really is about, okay, when I have this finding, this is what I need to do. It is very algorithmic, I would say. Some of it really does depend on like knowing the pathophysiology, understanding what can happen, and that doesn't hurt you per se, but there are going to be a lot of questions that are very algorithm based, and so I think it is important for you to sort of clue into that as early as you can, because I don't know that I think I noticed it, but surgery was my first clerkship, and so I don't know that that was something that I was really paying a whole lot of attention to when I was studying. So pay attention to that. I think you'll be fine. I think you're going to make it, and if you don't finish all your UWorld, that is fine. There are many, many people who don't finish it all. If you don't do Anki, you will be fine. There are many people who don't do Anki. I didn't do Anki during surgery. I had in the past, but I just didn't feel like I had time, and that is also fine. Take care of yourself during surgery. It can be a lot to adjust to, but I hope that you have a lovely, lovely time. We will probably do a short episode on surviving your surgery clerkship, just basic tips and tricks on how to be a human while you are enduring some of the longest hours you've probably ever worked. Some of you are more seasoned and won't need those tips, and that is awesome, and I'm happy for you for that, and also sad that you've worked that many hours prior in your life. So stay tuned for that, and then we will jump back into clinical stuff soon. Okay, talk to you later. Bye. That's it for today's podcast. You can support this podcast and receive exclusive educational content on Patreon, and find us on Instagram at Sterile Field Guide. Questions and requests can be submitted to our Gmail at sterilefieldguide@gmail.com. Thank you for listening, and until next time, may your retraction be superb and your suture tails be the perfect length.